This next patient is a patient of mine who we've all had. She is the high-risk multip who pulls a drive-by and delivers in triage. So she is a 26-year-old. She is a G8P5025 at 39 weeks. She is an unscheduled admission in active labor at 9 centimeters. She barely made it up from the parking lot. She got in through the door, and the charge nurse, called the resident immediately. Let's go. This patient's rocking and rolling. So she also has a history of postpartum hemorrhage with pregnancies 3, 4, and 5. And as we know, when you show up in 9 centimeters as a grand multip, you may not get IV access. And in this case, we did not. So she precipitously delivered a 3,100 gram infant in triage. She had no IV access. The baby was on the monitor for a split second before that happened. And it was immediate, complete apnea with audible blood loss. It was one of those ones where you get shivers up your spine because it's that much that quickly. And it was so much that we thought that she had inverted her uterus at the time. So we did an exam, confirmed that her uterus was in fact not inverted, and then had to work with the blood loss. And we're talking seconds here from delivery of placenta to the bleeding to the exam. And thankfully, we stock Jada's in triage, and she didn't have any IV access. So we immediately put the Jada in. We put it, and there's options with, when you place the Jada, how much do you put in the cervical seal? What do you put the suction on? And at this point, we had been using Jada for quite a while. And so we put in 120 cc's in the cervical seal, which is the max, and we put it up to that 80 millimeters of mercury. And almost immediately, the bleeding was controlled. We went from a really unsettling couple of moments to everybody can breathe now. And actually, she experienced really no further blood loss. So the bleeding was controlled. We established IV access. We were able to initiate our normal, 3 hours of postpartum Pitocin to reduce the risk of the hemorrhage that she'd already had. Although I guess she didn't actually have a hemorrhage. And then the Jada stayed in for the 60 minutes. We stopped the suction, gave it the 30 minutes additional. She had no further bleeding, and we removed the Jada. And that really all just happened in triage. She never actually made it to a labor room before she went over to postpartum. And this is one of those cases where it's helpful to have the Jada on your hemorrhage cart. It's helpful to stock Jada in triage. It's helpful to have it in the go bag that you have when you have to run down to the ER for the patient who's laboring in the ER or who delivers in the atrium or the parking lot. Because there's almost always, well, I guess maybe not the atrium or the parking lot, but there's almost always suction in every other aspect of the hospital. And so it's one of those things that's easily portable and easily hooked up kind of wherever you are. For this patient, thankfully, she required no blood products. She had a completely unremarkable postpartum course. She was breastfeeding at the time of discharge, and she demanded a 24-hour post-delivery discharge. There we go. And so she had her 24-hour infant testing, and as soon as that was resulted, she was out the door with her kid, and did quite well. So that was really, really rewarding.